This is the 7th track on the Leicester Oral History Trail. Saxon House, on the corner of Causeway Lane and East Bond Street, is on the site of Leicester's first maternity hospital. Housed in 7 converted cottages, the hospital opened in 1905 and closed in 1971, when the Leicester Royal Infirmary opened its new maternity wing. In this extract, Elsie Aldwinkle, the clinic sister at Bond Street, recalls the hospital after the Second World War, and Frank Rawson remembers a painful visit to have his tonsils removed when he was a boy in 1917.
If you read the newspaper at night and saw the births, some people would say Causeway Lane Maternity Hospital, some would say Bond Street Maternity Hospital, and some would say Leicester Royal Infirmary Maternity Hospital.
Yes.
Just Bond Street,
Straight,
and
yeah.
without the trimmings,
Yes.
just Bond Street.
Yes.
When I came along, there was a new building at the end of the cottages. This new building contained a theatre and some labour wards. So it meant that as the women came in to have their babies, they went into the labour wards and then they were transferred to their bedrooms. And if the bedrooms were in the cottages, then it meant a trolley taking the patient from the labour ward on the new part down a ramp into the cottages, and the trolleys actually wouldn't go into the rooms. Yes. So the woman had to get off.
Yes.
And just trot in. Behind Bond Street, there was the John Fair Hospital.
Well, it would be 1917, and the war was on, of course, and I was then 11 years old. Now, about this time, they started to send a doctor round the school to examine the children, and I was duly examined, and the doctor said that I needed my tonsils removing. So, all right, some months after, I had a card come down to say that if I would attend the Fair Hospital, which was in Bond Street, I could have my tonsils removed. It was only a small building, really, a red brick building. Oh dear, because at that time the only anaesthetic, obviously, that was known was chloroform. And I well remember putting that mask on my face and how I fought for my life. I struggled. I thought I was going to be choked and smothered. Anyway, they held me down until eventually the chloroform took effect and I'd gone off. At that time, all the doctors seemed absolutely mad on this tonsil business and adenoids. I was told that several of my teeth ought to come out. Once again, we went to what was then the Fair Hospital. I was sat there, and the first little boy that went in, oh dear, there were shouts and yells, and he came out with his handkerchief covered in blood. Oh dear. Well, anyway, because it eventually came to my turn and sat in the chair, and there was a big nurse there that she had a big teddy bear, and she stood in the corner of the room and you look at my teddy bear, look at my teddy bear, come on, look at my teddy bear. And while you were looking at the teddy bear, the dentist slips round and pulls a tooth out. As far as I know, we never had anything on it. Oh, you beauty. We shouted, and of course, come out the handkerchief covered in blood. Well, my mother said, I can't stand this, I'm not taking him again, I'm not taking him next week. So my grandmother, who was a bit of tougher nature, says, oh, all right, yeah, I'll take him, let me take him. So my grandmother took me the next week, but she couldn't stand it either. She says, oh, no, I'm not going down there again. The poor little kids, treat them like cattle. And we never went again, and I never went again, but I was so scared of dentists after that lot that I suffered agonies with toothache, agonies, and I wouldn't go to a dentist because of the painful experience that I'd gone through.
And when the National Health Service came in, that went out, you see. The John Fair became empty. It wasn't required anymore. And it was empty for a long time, until it was finally decided to attach it to Bond Street. So we had extra beds, extra warm. We had a special care unit. Quite a difference. It meant more staff, more doctors. There was a better theatre, and we didn't send our patients then to the Royal Infirmary. And the Royal Infirmary, in fact, their ward was closed down. They did no more midwifery, and we had it all. So you see, we became much, much larger.
Yes.
For the next stop, move along Causeway Lane and turn left into High Cross. Stop near the overhead walkway. If you need to take a break, there are toilets here and places to eat and drink inside the High Cross shopping centre.